All right, let's go ahead and move on to our 11 a.m. item. Thank you for your patience. Public hearing for the Lake County Hospital Improvement District. And looks like Mr. Rickelman is coming up.
Good morning, Board. Ben Rickelman, Deputy County Administrative Officer. I'm here for the public hearing for the proposed Lake County Hospital Improvement District. As it is a business-based assessment district, it's required by state law to have both a public meeting, which we had earlier, and now a public hearing. And the last step would be a resolution of formation. So on a subsequent board meeting, we would bring that forward for consideration. For this meeting, I did, as discussed in the public meeting, a template for the annual report. So that would give a flavor to kind of the annual reporting requirements the two hospitals, Sutter Lakeside and Adventist Clear Lake, would provide. It would show the additional compensation they would receive from the federal government through this district, and then the activities and programs the money was spent on. I do have here leadership for both hospitals and their council, if there's additional questions.
Thank you very much. Are there any comments or questions from board members regarding this item? Seeing none, I do want to talk about the report. I appreciate that there was effort made to create a template of a report of what would be coming to us. I'd like to suggest some additions. I'm not sure exactly how those additions would be added, but here's basically the concept behind it. We have 51% or more of our population that are Medi-Cal recipients and that are served by these hospitals in some way, shape, or form, or through other clinics. Part of this came to us due to the reimbursements that Medi-Cal provides, which is unfortunately the lowest reimbursement rates that they'll probably receive compared to private insurance or others. And so I'd like to make sure that we're still serving that population as things move forward with this business improvement district. So if there's a way to see if there's a increase in Medi-Cal patients that are being served or stagnation, something that can help us better understand that we're still serving that population in the best way possible. Also, this was talked about, and I was told it won't have an impact, but I think it'd be useful seeing, I don't want to call it fees, maybe it is called fees, maybe it's called rates, I don't know, but to see what are the current rates today for medical services and what will they be in the following years. Are we seeing the standard increase that we're seeing across the board for all healthcare facilities throughout the state, throughout the country, throughout the county, or are we seeing a sudden 50% increase where I think that would be a red flag type of situation? And so those two types of items, again, I don't know how to specifically request the exact data, because I want to make sure it makes sense. But those are my two thoughts that I would like to see added to the report for something that I think should be fairly simple to provide, but just to make sure that the taxing of the entities has not increased the fees, and that this approval of this business improvement district has been to the benefit of the Medi-Cal recipients that we know is the majority of our community members in Lake County. Like to hear from my colleagues about those additions and their thoughts. I'd also like to hear from the hospitals on their thoughts on if that's a doable request or not. Any comments regarding that? So let's hear from the hospitals.
Good morning, Board. Chuck Cassis, Administrator at Adventist Health Clear Lake.
Good morning, Board. Tim Stevens, CEO at Sutter Lakeside.
And what you're suggesting is very easily to add into our report, so we'd be happy to comply with that.
Okay. Thank you very much.
All right. That answers it for me then.
Yeah, me too.
Okay. Looks like there's consensus to see if we can add that in the report in the appropriate way, because my wording may not have been the most appropriate way. But I do appreciate the support for the annual report and this effort made to bring us what would be suggested in there. And the financial statement, I think, is an important part of that. Let's go ahead and open it up for public comment. We have Betsy Kahn.
Thank you, Mr. Chair. Betsy Kahn for the Essential Public Information Center. I have 3 questions for you regarding this item. On page 5, in the 3rd and 4th paragraphs of the management plan, the expected revenue is estimated to be $84 million, roughly $84,600,000, based upon what is expected to be an annual income of $16,900,000. But the first paragraph says that the current revenue being generated is $15,300,000, which amounts to $76,500,000 over the 5 years. How did you get that? How did you make that leap? What was that based upon? The next question is, in the 5th paragraph, it states that the district will be governed by the Lake County Board of Supervisors, which will be responsible for collecting the assessments and will update the assessments using patient revenue from hospital Medicare cost reports. And it should also include Medi-Cal reports, Medi-Cal revenues that are reported. That seems to be a little lapse there in the language. There's nothing in the management plan that indicates how the Board of Supervisors will govern the district. And in the last question is on the 8th paragraph, it says the county may withdraw or use money in the account only for a purpose authorized in the plan, but I did not see any statement of the purposes authorized in the management plan. So I find these areas of missing information to be significant enough that I believe you should require those before you approve this proposal. Thank you.
Thank you very much. And so we received 3 questions. Mr. Rickelman, would you like to make an attempt? Do we need the hospital leadership to come up?
I can go through them and then we can go from there. So with the ramp up, I'm assuming, and I think council can answer this better, but it's just kind of anticipated growth with the Medi-Cal population service. So, I mean, these are estimations, and so it's a reimbursement of service. So we'll just have to see where that goes. These are projections. For the services, we've kind of talked about this before. You know, as a county government, we're not in the space of operating a hospital. And so we have these metrics, reporting metrics back in the annual report, and showing that it's not impacting fees, and then they'll report out what they're doing with these programs and services. So I think the hospitals are much more qualified for that, but we do have the oversight mechanism as the board overseeing the district and then the annual report.
And the district being the financial district and the funds that we receive and provide to the hospitals for the projects and plans that they will have.
Correct. And the initial term of the district is just 5 years, and then it would require board approval for renewal. So this isn't for an indeterminate length, so we'll have oversight and see how it plays out.
And just if I may add to the first question about the difference between the 15 million and the 16 million, it does say in that second paragraph where 16 million is there that there will an anticipated growth of 5% each year. And so you start out with the 15 million, you get the 5% increases, and what the first paragraph starts off with is it would be an annual average. That doesn't mean that's the first collection. It doesn't mean it's the last collection. It just means overall there will be an average because of the anticipated 84 million total that will be collected. So projections, but that's more looking at the overall 5-year term versus a single year term based on projections from today. I did like the comment about Medicare. Maybe we could, if possible, Medicare and Medi-Cal cost reports. Not sure if that's something that would add a burden.
It's the same report.
It's just called Medicare cost report?
Yes, sir.
It includes, okay. Okay. And I think you alluded to it, there is no very specific project list based on what these funds will do, but there is a vague description of what they can be utilized for. And it was mentioned earthquake retrofit type of potential projects and things of the likes. So I think that we will hear the report of what it is being spent on. It's not up to us to say what you should be spending it on. At least that's my perspective on it. Okay, I'm seeing nods. And so let's go ahead and bring it back to the board. There's no further public comment. And at this moment in time, we will be coming back. What's the date again?
Yeah, December 3rd.
December 3rd. Okay. And so we will see each other again. Let's see how we move forward. Thank you very much.
Sounds great. Thank you, board.